The National Nurse Aide Assessment Program, NNAAP exam, is a standard for evaluating the competency of certified nursing assistant, CNA candidates. One of its critical components is the skills demonstration, where candidates perform hands-on nursing assistant tasks, evaluated through a structured skills checklist or evaluation form. Let's begin with a closer look at the NNAAP Skills Evaluation Form. This is the foundation of how CNA candidates are scored during their clinical skills exam. The NNAAP Skills Evaluation Form is a standardized document used by examiners to score CNA candidates during the clinical skills demonstration. It includes a list of required CNA skills that candidates must perform. It provides a step-by-step breakdown of each skill with specific actions or procedures. It designates critical steps, key actions that must be done correctly. And finally, it outlines the scoring criteria that determine pass or fail based on completion and accuracy. In short, the evaluation form is your official roadmap. It shows exactly what skills matter and how they'll be judged. Now, why does the skills evaluation form matter so much for your CNA journey? First, it ensures consistency and fairness in testing. Second, it focuses heavily on patient safety, infection control, communication, and technical proficiency. Third, it helps candidates identify which parts of each skill are vital to learn. And finally, it provides immediate feedback for improvement. This means the form is not just about scoring. It's a learning tool that highlights exactly what you need to succeed. Next, let's go over some of the common CNA skills you'll find listed on the NNAAP evaluation form. These include hand hygiene, ambulation with a gait belt, and providing a partial bed bath. You'll also see catheter care, denture care, and dressing and undressing a resident. Other skills include feeding a dependent resident, measuring vital signs such as temperature, pulse, and respiration, and making either an occupied or unoccupied bed. Mouth care, positioning a resident, transferring from bed to wheelchair, and toileting assistance are also part of the list. And finally, the proper use of personal protective equipment, or PPE, is tested as well. These skills are the backbone of the CNA exam, so mastering them will give you confidence on test day. Now let's walk through how the NNAAP skills evaluation actually works, step by step. First, skill selection. Before your exam, you will be informed of the skill or skills you will demonstrate. Each skill comes with an associated checklist on the evaluation form. So from the very beginning, you'll know exactly which skill is being measured and how it will be scored. Next is preparation. You'll need to gather all supplies required by the skills procedure. This step shows organization and readiness, which examiners will notice right away. Having your supplies ready not only saves time, but also demonstrates professionalism. Now let's move to introduction and communication. Begin by introducing yourself to the resident or evaluator, explaining the procedure clearly and respectfully, and ensuring privacy and comfort. This is a critical step. In fact, it's often marked as mandatory, and failure to perform it correctly may result in failing the skill. So remember, strong communication and respect for the resident set the stage for a safe and successful performance. After preparation comes skill demonstration. Perform each step as listed on the evaluation form in the proper order. Always follow infection control protocols, including hand hygiene and use of PPE. Use correct body mechanics, and most importantly, maintain resident safety. By carefully following the checklist, you show both accuracy and consistency in your skills. Now let's focus on critical steps. These include hand hygiene before and after the procedure, providing privacy, using proper technique for transferring or positioning, and properly measuring and recording vital signs. Another critical step is ensuring the resident's comfort and safety throughout the procedure. Remember, failure in any critical step results in immediate failure of the skill, no matter how well you did the other parts. Finally, let's look at completion and documentation. Always finish by cleaning up supplies and the environment. Leave the resident in a safe, comfortable position. Perform hand hygiene again, and if documentation is required, either record it or verbally state the steps you performed during the exam. In short, ending well is just as important as starting strong. Completion shows professionalism and attention to detail. Now let's take a closer look at how the NNAAP evaluation form is broken down with key sections and real examples. First, ambulation with a gait belt. Step 1 is to explain the procedure to the resident. This is a critical step. Step 2, lock the bed brakes and the wheelchair brakes. Again, a critical step. Step 3, apply the gait belt securely around the resident's waist. Step 4, assist the resident to stand using proper body mechanics. Step 5, walk slightly behind and to the side of the resident while holding the gait belt. Step 6, assist the resident to sit back down safely. And Step 7, remove the gait belt and perform hand hygiene. For this skill, all steps are considered critical, meaning every action must be done correctly. With ambulation, precision matters. Missing even one step can lead to failure. Next, let's look at the partial bed bath. First, explain the procedure to the resident. This is critical. Then, provide privacy by closing curtains or the door. Next, perform hand hygiene and put on gloves. Step 4, use a clean washcloth for each area. Step 5, wash the eyes from the inner to the outer corner without soap. Step 6, wash the face, arm, hand, chest, abdomen, leg, and foot. Step 7, rinse each area with a clean cloth. Step 8, dry each area thoroughly, paying special attention to skin folds. Finally, Step 9, remove gloves and perform hand hygiene. Every single step in this procedure is marked as critical. This shows how essential infection control and resident safety are during personal care tasks. Now, here are some tips to successfully pass the NNAAP skills exam. First, know your critical steps. Prioritize memorizing the mandatory actions. Second, practice complete skills, and don't just memorize. Understand the purpose behind each step. Third, manage your time. Stay calm, work efficiently, but don't rush. Fourth, communicate clearly. Speak to the resident and examiner throughout to show professionalism. Fifth, maintain safety. Always check bed and wheelchair brakes. Use proper body mechanics and protect privacy. And finally, prepare your supplies. Have all equipment ready before starting to avoid delays or interruptions. By combining knowledge, preparation, and calm communication, you'll set yourself up for success. Finally, let's talk about what examiners look for in the evaluation form. They check for accuracy. Are all steps performed correctly and in order? Safety. Was the resident protected from harm throughout? Infection control. Was hand hygiene and glove use done properly? Communication. Was the resident informed and comforted? Professionalism. Did the candidate maintain respect, privacy, and dignity? And documentation. Were vital signs or intake and output recorded correctly when required? These categories are the examiner's checklist for your performance. Mastering them means demonstrating competence, professionalism, and safety. The NNAAP-style skills evaluation form is an essential tool ensuring CNAs demonstrate safe, competent care. By understanding the checklist structure, focusing on critical steps, and practicing complete procedures, candidates prepare themselves to succeed on the CNA exam and in clinical practice.